Hi, welcome to Candid Chats on Cancer. I'm Mary Robinson.
And I'm Jamie Moore. So Mary, who are we chatting with today?
We have Sandra Krieber with us today, and she's from Heartland Chiropractic, and she is a licensed acupuncturist.
Welcome.
Thank you for inviting me.
So can you tell us a little bit how acupuncture can be beneficial and helpful to people with cancer and people that have survived cancer?
I can. First of all, I think I'd like to just explain a little bit about what acupuncture is. So that way anyone who's new to it understands what it is that I do. Acupuncture is, of course, the use of needles to we use needles to help move the energy. So it's all about balancing the body. Acupuncture is just one component of the medicine that I practice, which is called traditional Chinese medicine. And so what acupuncture does is it helps focus on balancing the energy or the qi in the body. And by balancing the energy in the body, we can help support the body so it can work more efficiently or more effectively. So some of the examples that we use acupuncture for, especially for individuals that are perhaps undergoing chemotherapy, is for help with nausea and for vomiting, and even some pain that might be part of the picture when they're going through chemotherapy. And then for people who are done with chemotherapy, it's really about treating the whole body so we can help with preventative care. Traditionally, acupuncture has been around for over 3,000 years, and we would use it for preventative, we'd use it for diagnosis and treatment of some disease, and then we'd also use it for general well-being. We know that acupuncture is great for calming down the nervous system. So for example, individuals that have emotional disorders going on, like anxiety or depression, it can be very helpful, along with lots of other things.
Okay.
What about neuropathy? Like, some people get neuropathy. Didn't you get neuropathy during your chemo treatments?
Yeah, I got very severe neuropathy in the hands, and mine went all the way up to my knees. Yeah.
Is that something?
I do currently see patients that do present with neuropathy due to the chemotherapy. And it helps to, of course, when you're undergoing anything and medication is part of the reason why it's happening, it's not going to necessarily take it away completely, but it can certainly help with the pain and the discomfort. And that's really what we know acupuncture to be used for primarily, is for pain, even though, like I said, it's used for so much more. But we know that for pain, especially, it's very, very helpful for. So it certainly can help support anyone who's going through chemotherapy.
Yeah.
And like I said, there's research that shows that it's great for chemotherapy-induced nausea and vomiting. So, there are really good benefits with checking out acupuncture.
Yeah, and a lot of us do get very, very sick.
I was going to say, why didn't I think of that when I was going through it? Because I did have a lot of nausea and vomiting, and sometimes medication doesn't work.
Right.
Medication also just makes the body even more toxic than what it already is, and so I don't know if I could really call it non-invasive, because you do use needles.
Needles, I do.
But it is an alternative to taking medication for nausea and vomiting, or does it make the medication just work better?
Well, it can do both. If you're on medication, the nice thing about acupuncture is if we can move the energy, called qi, in the body to help it work more efficiently and effectively than the medication that you're taking, you may not have to take as much, or you may not have to take as often, or you may not even have to take. So it can work in conjunction with whatever it is that you're doing. It doesn't have to be just acupuncture.
One or the other.
Right. But for a lot of people who are already taking a lot of different things, it can be an alternative to having to take one more medication. But again, like I said, it can work in conjunction with whatever you choose to do. It's just nice that acupuncture can certainly help with minimizing how much someone might have to take.
Mm-hmm. And do they need to talk to their private provider, their health professional, before they do acupuncture, or if they are thinking about getting off of some of their medications? Because you probably don't tell them in that area what they can and can't do.
Right, I can't tell a patient to not take their medication, but I always do say that if they're having side effects from taking a medication, because when your body's working more efficiently, but you're still taking the same amount of medication, you might start noticing some of the side effects a little bit more. So that's when I think it's really important to talk to your doctor about whether or not it's too much, and whether or not they can wean themselves either off of it completely or at least take a lower dosage. And I always encourage my patients to talk to their physicians in regard to anything that they're doing, especially if they want to do acupuncture. It's not necessary. I mean, you don't have to talk to your doctor to go and see a licensed acupuncturist, but it's always nice to include whoever in your circle of care providers.
Right.
include.
No, I think it's a wonderful thing that you do include the physicians in with it, because all the physicians that we've had the opportunity to talk to and go to, there isn't one that has ever said that I want you to stay on a specific dose of anti-medicine, anti-nausea or anti-diarrhea or anti-something, if there is a more safer way of doing things. And it really does sound that acupuncture, I'm an RN, so I have nothing against medication. But on the other hand, if I can do something that doesn't require medication, that can relieve my pain and my nausea,
right?
That's kind of like, that's an duh moment for me. But here's my next duh moment. I don't like needles. That's why I'm a nurse and I'm on the other end of the needle.
Who does like needles?
Yeah. So, but I've heard that it's nothing. It's very painless, and you don't.
It really is.
So, do I have an unfounded fear of?
Well, I mean, most of us are used to the kind of needles that you work with, not with the kind of needles that I work with.
The ones that are about this big around and about this long?
Yeah, I do have a lot of people that come with those same fears. But what I can say is the needles that I use are very, very thin, fine. Of course, they're needles, so they will be sharp, but when they're inserted, you might feel a little bit of a prick, but once it's in, it's not going to induce a whole lot of discomfort for the person. And in fact, it's going to help them relax. And I know that sounds kind of crazy, putting needles in the body is going to help relax someone. But because of the fact that we have meridians, these energy pathways in the body, when I put needles in a specific area of the body, what I'm doing is I'm helping the body to release certain hormones, to release whatever needs to be released. So move something to an area that needs it, or move something away from an area that doesn't need it. And if I can help the body just by putting needles in, relax. So yes, you might still be afraid that first time or have some reservations with the needle, but it's, like I said, most of the time you're not even going to feel the needle. Once in a while you might, because it is a needle, and it is, I am inserting it into the body. It doesn't go deep. I'm not looking for nerves. I'm not looking for a specific nerve pathway. I mean, I'm following the meridians and the points that are on those meridians. And the meridians are just kind of like, I say, just to let people know what a meridian is.
Yeah.
It's kind of like a road in the body. Okay. So you have these main roads in the body, and what happens over time is that some of the roads get really congested. It's like driving through Chicago during rush hour. Things get stuck. So if I can do things by putting certain points in the body to help release some of that congestion, then the energy can do what? It can move to do what? To support the body in what? In releasing nutrients into wherever we need to release nutrients to take toxins out of the body.
Right.
And that's the balance of using traditional Chinese medicine. Acupuncture is just one part of what I do. Even though I'm an acupuncturist, I do, I practice traditional Chinese medicine, which includes dietary advice. It includes herbs if they're interested. It includes Tui Na, which is massage. It includes cupping, moxibustion. I mean, it includes a lot more than just needles.
No. Cupping has really been something that's very interesting to me. I see the professional athletes that are cupping, and they, the professional athletes know good nutrition, toxicity. Can you talk a little bit about cupping? Because I know a lot of us that are recovering from chemo, we would love to get the chemicals and the toxicity, out of our body in a non-chemical way. Can you talk a little bit about cupping?
The way I use cupping primarily, and what you're probably seeing on TV, is with athletes that have very, very tight tissues. So I use cupping. I use it during the winter months especially, because that's when our lungs can become a little bit more susceptible to bronchitis or to pathogens coming in. So it's you can do it very gently. It's just a nice way of releasing restrictions that tend to be held in the tissue itself. Even though I am working on the energy pathways of the back, I'm still working with releasing restriction and tightness. So it can certainly, we do hold toxins in the body, and one of the ways that we can release it through cupping is by, by creating, when we do cupping, if I don't do it as gentle, you may have, we call them markings, but they're bruises. And what that entails, or what that does, is it brings stuff to the surface, breaks the capillaries a little bit to get the blood flowing. So cupping wouldn't necessarily be something I would use on somebody who's really deficient, like someone who's
That's what I was wondering.
It would be somebody whose constitution or who's doing a little bit better. It would be something that I would use later on.
More down the road.
Yeah, I wouldn't use it on somebody who might already be deficient or struggling with their immune system. It might be too taxing. So, yeah.
Well, and I was also going to ask you, have you ever done acupuncture without needles? Because I've heard of people, either using like a laser for like children is what I'm thinking.
I use needles with children.
You do? And
I
what
do.
about
But
like
I use
water and
different.
cotton balls and using the energy of a source? No, you don't do
Well,
that
I
either.
do
You use
electro
needles always?
acupuncture, but I always use needles. And even with children, I use needles, but the needles I use are going to be a little different. So the youngest child that I've ever worked on was 9 years old, and he was afraid of needles, so I wish I would have brought some with me, but I use different kinds of needles. And needle retention time differs between an adult and a child. So a typical treatment with an adult is usually an hour and a half. An hour and a half because I go over an intake form. The intake form has lots of information, lots of questions that most of us wouldn't even tell our doctors, because our doctors aren't asking those kinds of questions. I take a look at your tongue, I take your pulses, and then based on that information, I come up with a treatment plan. And needles are retained either anywhere from 15 minutes to 45 minutes. It really depends on the person and what they're coming in for.
It works that quickly.
Yes, but for adults, for a child, I could leave the needles in for 2 minutes to 5 minutes, depending age. So it just really depends on what's going on and age.
I know, Mary, as an RN, I was very skeptical of acupuncture. Not necessarily Chinese medicine, because I do believe there's a lot of validity to Chinese medicine, but But to acupuncture, I was very skeptical. Except I had a pup that was born with only one kidney, and she ended up in renal failure. And so we took her to an acupuncturist. And one of the few things that dog ever did, she didn't like going to the vet, and she knew the vet's office in a heartbeat. But she also knew the acupuncturist's office. And just even saying, "You want to go to the acupuncturist?" Right in the car. And there was one needle that they put that was at the base of the skull. And they put one in there, and this puppy, which was not really a puppy, she was about 3, would just go, just the most relaxed, calmest thing. And she was in no pain because she was in severe pain due to the kidney disease. I became an immediate believer in acupuncture because animals and little kids, there's not a placebo effect.
Right.
It either works or it doesn't work. And you know, with my dog, we kind of explained to him or her on the way there that acupuncture is going to do this, this, and this, and this, and we'll put it all in their head. And you know, no, it wasn't that at all. So I'm a full believer in acupuncture. I haven't got the guts up yet to do it.
I've done it, just so everybody knows. A few times, actually.
But back in my mind, what I'm thinking is, I would love to come to your office, and if you don't mind, bring a camera crew. That way they can all
Absolutely.
watch me crying in the parking lot. And shoot another episode of, in your office and have you do, I'll do it.
Okay.
Awesome.
I'll lay on the bed, I think.
Well, and I can do it if he wimps out. How's that?
Sounds perfect. I would love to have you come.
Oh, good, good.
So what else can you do to help us with cancer, to help us recover with cancer
Well,
or deal with it?
I think that, you know, a typical appointment with me isn't just acupuncture. I mean, there is a lot of talking. So, you know, I don't rush through
Good.
anyone's appointment, whether you're coming for the first time or you're coming for the second or third or fourth or fifth time.
That's a beautiful thing, because a lot of times we do just feel like we're rushed in the office, and then we're rushed out of the office, and then we go, I have a question. Okay.
And you know, I give suggestions. I mean, you know, sometimes it's just nice to have things to do to help. If you are still feeling a little anxious, so what can you do? And in, you know, part of Chinese medicine is Qigong, which is, when you translate it, means breath work. Okay. So I work a lot with the breath and encourage people to work with their own breath just to help calm down their nervous system. So, you know, dietary advice, there's lots of things that I've done to help support anyone that comes in. So.
Would it take long? Could we do a breath example right now of what you would do with somebody? Or do we have time? I mean, is it just like a 5 deep breaths, or is there more to it than that?
There's more to it.
Oh, there is? Okay.
Yeah.
So that's another thing. So I'll do the acupuncture, you do the breathing. There we go.
As long as I know what I need to do, because it's not just breathing is what I'm
breathe
hearing.
in, breathe out is what I heard.
I mean, well, it sounded like there was more to me,
There's
but
a little
Yeah.
more, but
Oh.
Yeah, we can become masters
I mean,
of
I
this.
could do the breathing.
Something
I'm
that's-
doing it right now. But
Something that's taken her years to learn and probably certifications, and you know,
Yeah,
no, we probably can't learn it immediately, but it would be nice, yeah, for us to come and actually have you know, start a session with Mary with her breathing, and I'll guinea pig, and I'll pull it all in my big boy panties, and I'll go with the needles, and if I can do it, then you know anybody can do it. I like that you're encompassing not just one particular thing. You're looking at the body as a whole. And you're also looking at energy as a whole, if I'm not mistaken what you're saying, with nutrition, how to add energy to the body. And then through everything else that you teach the body how to become more efficient in its use of energy.
absolutely. because health is what? Health is all about balancing not just the physical being, but also the emotional part of us too. So I can't look at just a part of the body and treat just the part of the body. It just does, my medicine just doesn't work that way. I think people are surprised when they come in for pain, especially let's say low back pain, and I put no needles in the low back and they walk out feeling great.
Yeah.
Without having to put needles in the back to treat the back. So that's the fascinating, I think, part of my medicine is that I don't have to, you know, I'm still focusing on what's happening in the body, but I also have to support the whole, because what's creating the inability for the body to do what it needs to do. So you have to treat what's going on right away, but you also have to treat what's creating the manifestation of those symptoms. So
Otherwise, I can have all the energy I want in my body, but if it's blocked, it's going nowhere.
right, and it creates pain or disease or discomfort. I mean, that's what, you know, from a Chinese perspective, anytime there's pain in the body, it's because of stagnation. Something's not moving,
Cycling.
not cycling the way it's supposed to. Something's off, and the best thing to do is move your energy. And part of, like I said, part of doing it is like doing breath work at home. That also can help support your energy. So what I'm doing and what you're doing can support the whole process.
No, I've
That's
heard of
nice.
this thing called acupressure.
Mm-hmm.
Is that similar to what you do, or is it kind of just, is it along the same line, or?
It is. I mean, acupressure is pressure of the, it's based on Chinese medicine. It's just instead of needles, you're teaching people how to access energy points on the body to help support whatever's going on. So it's something that I can teach you and say, go home, give you homework to do if you're having pain, or if you're wanting to move something, you just do different points and it can help support the whole body.
Okay, so let's say that, I was taught acupuncture that here would be a point. Now, would the acupuncture work? Let's say if I do have a blockage coming off of my meridian, is this going to be as beneficial than if I do actually have good acupuncture first, then taught by you when it's the right time to start doing the acupressure?
I'm a little biased because I've seen things move so quickly with the insertion of acupuncture needles. So I would say do the needles first, but if you don't have access to needles, then absolutely, if you can do some pressure point, acupuncture point pressure to those, you're gonna still affect the body. It just might not be as quickly, because once we put the needles in, your body can shift and change immediately. So.
Okay.
Well, and how often does a typical person need to go once they start to alleviate some of their signs and symptoms of any condition they might have?
That's a great question. Most of the time when I see somebody new, they're coming in more often, so weekly. And I might see them once a week for 4 to 5 weeks, sometimes longer, depending on what's going on. My goal is to get them to the point where their body can hold the balance of what I'm doing. So if we can get to the point where it's every 2 weeks, then they'll come and see me every 2 weeks or every 3 weeks or every 4 weeks until they get to that point where they're doing so well that they just come during periods of transition or periods of stress. Because stress is during the seasonal changes especially, puts a lot of stress on the body. It's a great time to go and see your acupuncturist to help support the system. So when you go through that transition, you're not getting sick, or you're not susceptible to getting sick. So,
I just got a cold last week.
Or if you're under a lot of stress, I'd say come and see me a little bit more often. But most of the time, once you're feeling better, it's really up to you as to how often you want to come and see me. But you're going to come and see me more often at the beginning.
Cool.
And how much do your services cost?
I charge $110 for the first initial office call and then $75 for follow-up.
Mhm.
Well, that's actually very reasonable.
And-
That's like less of a price than a massage. Probably healthier too.
And I will say that if you have a health savings account or you've got PayFlex or you've got something like that, more than likely acupuncture will be covered.
Is it the question that I'm always asked, is it covered by insurance? Is acupuncture covered by insurance yet? It should be.
Some insurances do carry policies. Now,
Okay.
I'm not a provider for any of them, so I would absolutely encourage anyone who has a policy to contact their company, insurance company, and find out
Yeah.
if there's any providers that they can seek out.
All I know is for health benefits, $75 is a drop in the bucket. 75, yeah. If it's gonna make me not nauseated, makes me
Yeah.
feel better, makes me
Help with
not in pain,
Neuropathy.
helps with neuropathy and makes my immune system healthy for $75, okay, that's a no-brainer
Yeah.
on my part. All right.
Now, if
We-
somebody,
we have
just real
a little-
quick,
yeah.
if somebody comes in just one time, that's still gonna make benefits for them, right? I mean,
Absolutely.
okay, so like,
'Cause
let's say
I've
they
had-
just don't have the resources or the time.
Yeah,
They
I've
can
had
come in.
people come in one time and then maybe an hour later, half a, 6 months later, come in again. And
Okay.
he just said, I did so well.
That's good to know.
So-
That is really great to know. We are so glad to have you with us today, and I can't wait to come to your office and
Me neither.
have needles put in
Awesome.
me, because if it makes me feel better, I'm all for it.
Yeah.
Yeah.
Sandra,
We all
thank you
want
ever
health,
so
good
much.
health. Yes.
Welcome. Thank you for
Yeah.
inviting me here.
Thank you so much.
You're
All
welcome.
right, and join us again for another Candid Chats on Cancer.
Thanks, everybody. Be well.